it's important to receive good mentorship because without it, you just sort of have no guide to really help you through decisions that are going to come at key branch points. So there's a lot of things about clinical practice. Um, if you're an academic center like I am, faculty practice, but even if you're out practicing in the community and even taking that first job, negotiating, being able to manage the workload, where you're not going to learn that formally in your residency program. So on-the-job training with a mentor is really how one learns that. And so that's why it's crucial. So I think it's important to be a mentor so that you are understanding the views of, and the challenges faced by the younger people entering your field. And as a hospitalist, for example, if you're a hospitalist director, you need to be a really good mentor because that's how you'll promote professional growth. And that professional growth is so key to preventing burnout. And we know that that's pretty rampant in our field. And so the more growth you have, the less burnout that you're going to have. And mentoring is a key part of that.
That there was a geriatrician, Roseanne Leipzig, that was running a falls committee, and she was trying to spearhead this through the hospital. And so I met with her, and I wasn't looking for a mentor at the time, and I just started talking with her, and then I started, exploring what she was doing. I looked her up a little bit, and then I realized that this was a pretty good fit, and I asked her for a couple things, and I think this is where it sort of took it. And I said, I'm looking for two things. One is data of the falls on my unit, and I'm trying to get into this other meeting related with falls. And it was in the late afternoon. The following morning, we met, and she got me both of those right away. And it was just like a very nice pairing. It's almost like I asked for a couple things, she sort of provided, and then she needed some help with the falls initiative in the hospital, and I was a good partner there. And so from there, we started talking about a mentorship process, and that was a great fit.
During my residency program, and it was my program director in residency at the time, Holly Humphrey, and I was really interested in a career in medical education and also larger role in medical education as a resident on a national level. And so that's when she encouraged me to seek opportunities outside of our institution at organizations like ACP and SHM and others. She continues to be one of my mentors today, weighing options regarding professional growth and development here, career options, opportunities. She is somebody who I would consider going to for her mentoring advice. And I had just finished my fellowship, so it was pretty early in my career, maybe first year on faculty. I was very involved with the residency program, and I met a resident who was really interested in hospital medicine. And actually what happened was she was really interested in subspecializing, but then really didn't figure it out, like she didn't really like any one specific subspecialty and was thinking about what career to go into. And that's when I was like, oh, you should think about hospital medicine. As a career, it's great. You can kind of do all these things, and you're interested in medical education like me, you can make it work out. And so I helped recruit her to our fellowship and then mentored her during the fellowship.
I started this committee within our group called the High Value Care Committee, and we're trying to decrease overuse. And I mentioned at a meeting within the division that I was trying to work on reducing unnecessary telemetry monitoring. And it was a new hospitalist who was just coming on to the days, and she came up to me, and we were talking about sort of working on that project together. She said she wanted to work on a QI project. She didn't know quite how to get involved. She needed some, quote, mentorship. And it didn't hit me at the time, but as we met up a couple times and sort of progressed in the project, I realized that there was more things that she was asking me than the project itself. A little bit more about who to talk to, what are the next steps in career, and I think that was the first time.
That meant when we ask about why is mentoring important in hospital medicine, it's not necessarily that you have to have your mentor concordant with you in hospital medicine, but that you're more going to have a team of mentors, and you're going to get different things from the different team members. And it's actually important as a mentee to make sure that you're the one who's kind of managing up, as we say, and kind of making sure that all your mentors are on the same page and that you're communicating with them and they actually know where you're at.
I think we get into, we pick our jobs, and we don't quite have that sort of priority there of finding that one mentor from the get-go. I think it's important, and we don't do sports without a coach. It just doesn't happen. You want feedback from your patients. Am I doing a good job? Did I explain that the right way? Because oftentimes doctors don't, and I think we realized over the years that hey, patients don't even know what your name is sometimes, and if you think about it, you need that sort of relationship. You need that sort of feedback from them, and you need them to coach you in a lot of ways.
Is that we are training a younger generation of physicians who are more savvy in these areas. And so even though we think of mentors as very senior, sort of elder statesmen, if you will, I think we need to be really open to new models of mentorship, particularly this idea of reverse mentoring. And so the mentee and the mentee could mentor the mentor, for example, in how to use the electronic health record more efficiently. I find that is something the residents are the ones that train me in, and oftentimes they'll tell me, and I'll be like, okay, let's talk about how to enable this in your QI project. And so it can be a give and take. I think that it's really important to emphasize that mentoring is just not one way, and that even though there are people that are very junior in our field in hospital medicine that need mentoring, they're also in the really cool position of being able to mentor in specific areas that they know about.